So good afternoon and welcome. Thank you all for coming and joining us for this important annual report. My name is Chad Epps, and I'm chair of the Faculty Senate. It's my pleasure to introduce Ray L. Watts, the 7th president of UAB, for the 2014 State of the University address. Dr. Watts is in his second year as president, but has been part of the UA community for much longer. As many of you know, he is a native to Birmingham, received his undergraduate degree at UAB, and then returned to UAB in 2003 to serve various leadership positions in the School of Medicine and the health system before becoming president in February of 2013. I believe Dr. Watts is a remarkable leader for this university. At a recent visit to the Woodward House, the official residence of the UAB president, I noticed something a little different. There were lots of flowers. I had not noticed there before. And I asked him about this, and he said, "I love to plant flowers." And so I learned of his passion for gardening and for growing things. And I think UAB is no different in that respect. In his first year as president, he has worked collaboratively with the UAB family, as well as the community, the state, and nationally, to really grow UAB, to provide direction by establishing priorities, to get us started very successfully on the first year of our campaign for UAB, and also to make our campus greener and stronger. I think these are all things he'll probably mention in his address today. Dr. Watts has also worked very closely with the faculty to uphold the principles of shared governance to ensure our role as a premier university and academic medical center, and I very much appreciate that. I think most importantly, as faculty and as staff and as students, I think he is our friend. So I'd like you to all join me in welcoming President Ray Watts.
Thank you, Chad. Well, thank you very much, Chad, and thank you for your leadership this year as president and chair of the Faculty Senate, and I want to thank the Faculty Senate for the great work that they do throughout the year. Very important, representing the voice of the faculty, and Dr. Lucas and I enjoy our efforts together and our work together, and together we want to lead this university to new heights of excellence and achievement. It's a privilege for me to stand here today and represent you, all of the people who make UAB such a great institution. Our faculty, our staff, our very talented students, our alumni, community supporters, and government leaders all work together with us to help us realize the great opportunities that we have. As an institution, we have never had more opportunity to do great work than we have today. And I want to share that with you, and I'll be reflecting on much of the great work that you are doing. These are exciting times for us, and you can see some data here from our humble beginnings back in 1969 when we became an independent institution until the present. You can see both the growth of the size of the campus, a great footprint on the south side of Birmingham, moving northward every week, and you can see the growth of our student body, more talented than ever, among the most brilliant and committed students, not just in Alabama, but around the world. You can see our research funding has grown from a little under $9,000 to now almost $500 million a year. Our employees, our people, our greatest asset, 23,000 employees and almost 19,000 students. And with the thousands who come every day to our clinics and hospital and their families and others, we are a pretty good-sized city in the state of Alabama. The economic impact is over $5 billion a year and growing. And we are helping Birmingham transition to a knowledge-based economy. Collaboration and innovation have indeed always been hallmarks of UAB. And even though we're large, we want to keep that entrepreneurial spirit. We do not want to become bureaucratic and hard to deal with. In fact, we need to move the other way and constantly try to perform as a small organization with innovation and bold new ideas leading our way. There is no question we have a very bold vision for our campus, for its impact in our community, in our state, and indeed around the world. We are realizing that vision by having a dynamic strategic plan. That's a living, evolving plan, and vision without execution is ineffective. And we are executing well. We're committing our resources to our top priorities, and will continue to be disciplined in our investment in our priorities to move all parts of our mission forward. And indeed, our partners are investing with us. Knowledge that will change your world. That is not just a slogan or a short phrase to try to catch somebody's attention. That is indeed what we live by every day. And through this bold plan and vision, we're having a transformative effect. Every part of our mission is moving forward with unparalleled success. Education, leading-edge research, world-class patient care, economic development in our community and state and beyond, and indeed service to our community. These are our 5 mission pillars. We are pleased to continue to grow our student body, not only in number but in talent. This is the 6th year that we've had increased enrollment overall, now almost 19,000 students. About 11,000 of those undergraduates, and the rest graduate and professional students. We are very proud of the progress being made in our Honors College, which was established a little over a year or so ago to bring our honors program, our honors in departments and schools together and have a unified plan. You can see very talented group. Largest incoming class of 375 that we've had, all of whom are performing at very high levels and could be at any institution in the world and be at the top of their class. Importantly, almost 20%, 1 in 5, are first-generation university students. And we like that. We want to be a place of opportunity for all. We are very pleased to have welcomed our first Honors College Dean, Dr. Shannon Blanton, an accomplished political scientist in international affairs and leader from the University of Memphis, who joined us just some months ago. To accommodate the growth of our student body, we have over $100 million worth of building projects coming out of the ground right now. To be completed, the large residence hall, 714 beds, which will be focused on freshmen, and our Hill Student University Center in the summer of 2015. And each week I drive by them to see the progress made, and it's amazing how quickly they are coming up. We want to make sure that we have the safest campus possible for our students, for our faculty, and our staff. And some incidents we've had recently have just redoubled our effort and refocused us to take a look across the entire campus to make sure all aspects of safety and security are at the very best that we can make them. We've recently established a task force under the leadership of Vice President Alan Bolton, and we'll have an updated plan in the next 4 to 5 weeks. We have introduced some innovative undergraduate programs over the last year, and their enrollment is growing, and we have plans in the coming year to develop new Bachelor of Science degrees in areas of strength that draw across our campus, from College of Arts and Sciences to medicine and the health sciences, with new degrees in informatics, immunology, and cancer biology. We want to make sure that we serve our community well and that we give young people in our city and surrounding communities and in rural counties throughout the state an opportunity to come to a world-class university and to get the proper mentoring, advising, to be successful and to earn a college education and return to their communities to make them a better place to live. Education is one of the greatest differentiators from the standpoint of achievement, quality of life, and giving back to one's community. Our UAB Teach program, which is focused on undergraduates in science and technology and engineering and math who are studying in those disciplines, they can at the same time get a certificate to teach in those important disciplines in schools around the state. We have about 70 enrolled in our inaugural class, and we were fortunate to get a $1 million grant to help fund that and some community support as well. Blazing Start program is a program to give young people who maybe come from less privileged backgrounds, who might have an ACT of 17 or 18 or 19, particularly from our inner city schools, both in Birmingham and around in our communities, an opportunity to come to UAB, to be in a specialized program, and to have a first year that's heavily focused on mentoring and support. I'm pleased to say that all 42 from last year progressed through successfully, and you can see that several are on the dean's list and receive presidential honors. The dual admission program is a joint program with our community colleges. If students enroll there and are successful in their first 2 years and graduate, they can come to UAB with automatic acceptance. And our advisors are on their campuses to help them be ready to transition here to receive a 4-year degree. We have a new Master of Science in the biosciences, which gives students from different backgrounds who may want to pursue professional education a degree opportunity in a very focused scientific curriculum over 1 year to prepare them well to go on to a future in dentistry, medicine, public health, etc. In the past, they took a few courses, wandered, and didn't accomplish much beyond maybe improving their qualifications for admission. This gives them a very directed program. Very excited about the Gear Up Alabama initiative, which is the largest non-health grant that we've ever received, almost $50 million to be expended over 7 years to reach in rural counties in the Alabama Black Belt and help those students be prepared to come forward and achieve a university education. Our faculty and students continue to receive national and international honors. And you can see some of those listed here over the last year, achievements that we're all proud of. Our research is enabling us to develop and harness new technologies and to translate research into new life-changing treatments for serious diseases. Exciting work in engineering around revolutionary materials that can have an impact for safety from tornadoes and severe weather, diamond coatings that improve medical industrial applications, and materials that are going into a new design for a football or sports-related helmet to reduce concussions. Our cyber forensics group continues to be a national and international leader. And our laboratory of vestibular and oculomotor research is working hard to help understand the consequences of traumatic brain injury. We have worked hard over the last years to, in the most competitive environment ever, continue to try to stop the decrease and increase our funding in NIH dollars, and you see that for 14 we're going to have almost a 20% increase. And I've told everyone, while that's great, it's no time to take a breath and slow down. It's indeed time to move faster and go harder. We've had some big grants over the last year that have helped, and we're proud of our faculty across different schools and departments who are leading those. We are preparing to indeed be on the vanguard of 21st century medicine. And that's going to be based around genomic science and its influence on the future of medicine, how we diagnose, treat, and prevent major serious diseases. Under Dr. Vickers' leadership over the last year, he has established a new Personalized Medicine Institute, and some folks have asked me, what does that mean? Well, that means taking our own genetic information and looking at its influence on our risk of disease, controlling those risk factors, looking at our genetic makeup that will influence how different treatments affect us, either will help or will hurt, and indeed in the future learn how to prevent diseases that have a genetic basis. We have a new exciting partnership with Hudson Alpha in Huntsville that really combines their genomic science firepower with our Department of Genetics and others throughout the medical center to work together to underpin this personalized medicine approach. And sequencing a genome is not very hard now because there are machines that can do that for about $4,000 or $5,000. But once you have that sequence, the real brain power comes in deciphering it and see what it means. That's what informatics is about, using big data, high computational capacity to decipher the codes that underlie those risks for disease and risk for a bad outcome from therapy. We have been privileged over the last decades to emerge as a leader nationally and internationally in research. But it's not going to be enough for us to continue to stay where we are and maintain what we have. We must continue to excel, innovate, and grow, and continue to build critical masses of excellence around important priorities in science and medicine and engineering and other disciplines. So we're going to continue to build. We have an exciting campus master plan over the next 5 to 7 years. We'll probably build 5 or 6 or 7 new buildings over that time period. From the research standpoint and from the next research building standpoint, we're going to build a new genomic medicine and data sciences building on the corner of 18th Street and University Boulevard. We have a lead gift already for that building, and it's going to position us to bring people together around genomic science, personalized medicine, informatics. We also have plans for a new nursing building that will be just adjacent. This is our newly renovated School of Health Professions building, which has created some beautiful new world-class educational space. And our student health and wellness clinic has just been finished and opened at the start of this academic year. This is the Shelby building, and this is a future biomedical science building that's being planned. We have outstanding faculty who are very competitive nationally and internationally, but we must grow in order to continue to excel and compete. These are some of the recent recruits across many disciplines in science and medicine over the last year. Obviously, you can see they brought excellent funding and new leadership that will help us continue with the faculty we have to build more outstanding teams of investigators. We also have been very fortunate to recruit outstanding new leaders, and you can see many of them here. We are fortunate that if you get sick in the state of Alabama, especially in this community, you have one of the greatest hospitals and medical enterprises, not only in America, but the world. And our goal is to make sure that we provide outstanding leading-edge care here for our patients, for the citizens of Alabama, and others who come to us that is as good or better than anywhere else in the nation. You can see some of the attributes. Our hospital now is 1,157 beds large. It is full, and it is a place that the sickest can come and many times be healed. We have a world-class transplant institute, cancer center, adult trauma center, and with our children's hospital, which now has about 400 some odd beds, and their new platform, we have facilities that are truly second to none. We want to continue to have an even more powerful economic impact in Birmingham and in our state. Recent data showed that the Birmingham-Hoover economy is number 50 in the nation, and indeed our economy is bigger than Huntsville, Mobile, and Montgomery combined. Our region continues to grow as a biotech nexus with more than 120 biotech firms in our region, in our community. Innovation Depot continues to thrive, has about 95 companies now, about 10 are graduated each year, and another 10 come in, many from innovations that have come from UAB, Southern Research Institute, and others that we collaborate with. We have a new Institute for Entrepreneurship and Innovation, which is a multidisciplinary effort to bring the talent of our various schools and units together to spur innovation, to make it easier to transfer technology into commercializable products, and to be a nexus for training entrepreneurs. We have had a lot of success over the last year, and we'll continue to see even more as we move forward. You can see here a rendering of the atrium of a new Institute for Innovation, Entrepreneurship, and School of Business building that we're planning on the corner of University Boulevard and 13th Street, right in the heart of the campus as you come in off of 65. It's going to be a world-class 21st century Center for Learning and Innovation, and we hope that it'll be up in about 3 to 4 years. Our partnership with Southern Research Institute has never been better. Our Alabama Drug Discovery Alliance is truly presenting opportunities for developing disease-modifying therapies that will be blockbusters and have a tremendous impact for our patients and patients around the world. We have a new initiative around medical technology and medical devices with Southern Research Institute. We're very pleased to hire Dr. Bob Hergenrother from industry to come and be a leader across SRI and UAB engineering and medicine and science to help us focus our efforts in this very promising region. Tremendous commercial potential that'll have a big impact on our economy. Even as the state's economy has lagged somewhat, Birmingham's economy continues to move forward positively. And indeed, we want to create a research triangle type environment in the state of Alabama. The state this year put up $4.5 million for helping us recruit scholars, commercialization scholars, funded researchers, engineers, business entrepreneurs, and they will put in a $500,000 match to the institution's match to recruit this talent to Alabama. And it's across all of the research universities and institutes in Alabama. We're serving our community through partnership and empowerment. Our medical students continue to have their equal access free clinic on Sunday afternoons downtown at the Church of the Reconciler, and you can see the impact that they're having in that homeless ministry in providing health care to many of these people who otherwise would not be taken care of. We have a really exciting, dynamic cancer community network across the state and surrounding areas. And our schools of dentistry and other health-related schools are reaching out into the community. Through our School of Engineering and Business and our sustainability efforts on campus, we are working with the city and the county to improve our city. And we've worked recently with them on an IBM Smarter Cities Challenge grant to try to improve nutrition throughout our inner city communities, which have been designated many times as food deserts. I'm particularly proud of this and of you. In the first year of our campaign, we've raised almost $105 million to date we had the biggest year ever for giving to the Benevolent Fund, which is the fund that we as employees give to help our community be better. And you can see that we raised over $1.9 million. $1 million of that we gave to United Way, which goes to really important initiatives throughout our community to support those in need. This year we created a new community reinvestment fund and had a challenge grant opportunity for nonprofit organizations to put their best ideas forward, and a group of our benevolent fund leaders would decide on which to invest in. And we're building again a Habitat house in Pratt City, which will be finished in the next few weeks for a family, a mother and her 2 daughters, that will be their first home together. Our partnership with the Woodlawn community and Woodlawn Foundation continues to grow, and it's across all parts of our mission around creating an innovation network for young entrepreneurs with the Woodlawn Group, a summer bridge program for Woodlawn High School students to come and be in mentored programs to prepare them to take college credit classes, which will be coming forth in the coming year. Through our Art Reach, which is the community outreach part of Art Play, we've reached over 1,500 young people since its inception. Many of these never having an opportunity to have any sense of their ability in music or visual art or others. And it's really been transformative for them to see their creativity and their talent. We're very proud to support that. And we've had recently in the last year a childhood nutrition initiative, and you can see we've partnered with the Nestle Foundation to help make this happen. This past weekend we had an exciting event, and that event occurred at the Alice Stevens Center, which is our performing arts center, a world-class venue that brings world-class talent and highlights our world-class talent on our faculty in a beautiful setting, serving almost 120,000 individuals last year. We continue to work hard to raise funds so that we can make this venue available to all. Our Abrams Ingram Institute for Visual Arts opened in January, already has hosted 5,000 visitors and has a very exciting new unique exhibit opening in January 2015. And the Alice Stevens Center and Art Play have put together a very exciting program where the artists who teach in our various classes will come into our hospitals and share their abilities with people who are sick in Children's Hospital and in University Hospital. And the pilot programs so far have been truly remarkable. The Dalai Lama visited us this past weekend. One of his areas of focus is on healing, and he's an educated man, and he wanted to come and discuss the role of neuroplasticity, brain plasticity, in healing. And it was a very interesting, exciting symposium on Saturday with great discussion. And Ed Taub from our psychology faculty was one of the speakers, with some other distinguished speakers from institutions across the nation and Canada. It was covered widely, and through YouTube, social media, and our website reached over 100,000 people in over 100 countries. We are just nearing the end of our first year of the campaign for UAB, our $1 billion fundraising philanthropic campaign, which is really reaching out to our communities, to ourselves, our community, our supporters, people across the state and beyond, to share with them the great work that's being done here at UAB. Dr. Khan and her development team across the entire institution have put together a wonderful plan, and we have received nothing but very positive support. No one we've gone to ask for support has said no. It's a matter of finding the right fit, where their passions are, what part of our mission excites them, And we're not asking them to give to anything that we haven't already invested in. And that's why our strategic plan, knowing our priorities and investing our resources first, are so important. That speaks volumes to others as we ask them to partner with us. To support this and to begin to spread the message about the great work that's being done at UAB, we have developed some new video and other media presentations that focus on some aspects of the work. And to date, they have been extremely well received, and we're so thankful for the talent of our leadership. Dr. Kahn, Teresa Bruno, others have played a very important role in bringing their creativity to these
What if you
messages.
could prevent the spread of diseases by funding research? Change a life by giving a scholarship. Invest in the economy by creating more jobs. Or fund knowledge that would change the world. The truth is, you can. The campaign for UAB. Give something. Change everything. Let's do this.
Have you ever wished you could wave a magic wand and make sickness go away? Diabetes, a disease of the past. Alzheimer's, a faint memory. Parkinson's, nothing to fear. Unfortunately, wishing doesn't make things happen, but giving does. The campaign for UAB. Give something, change everything.
Let's do this.
Our campaign leadership, the co-chairs, Teresa Bruno, Johnny Johns, and Mike Warren, as well as Dr. Shirley Salloway Kahn, have done a fabulous job in working with our community to get them excited about our campaign and to lead by example. So we owe a great debt of gratitude, but as I've told them, yes, we're going to raise $110 million this first year. We're going to raise 110 or 20 for the next 4 and exceed our goal. And those funds are not just funds to raise and put in some account somewhere. Those are funds to raise and put to action and to be the execution part of the great vision and the great strategic plan that our faculty and staff and students and supporters have put together. Let me close by saying thank you for being here and thank you for all that you do, and I'll be happy to address a few questions if you like. Thank you very much.